I came back to the clinic in early 2024, working on the clinical team. I was a 5-day-a-week general dentist, and one of my earlier experiences was with a patient named Luis. I'd been here for a little bit, and I'd had my share of patients that were a little bit afraid, but I think Luis was my first kind of really deep dive into seeing what trauma can present like in a dental setting. He came in for his first visit with us for any type of restorative treatment, fillings, things like that. And I remember watching him walk in with my assistant and his mom and his sister, and he was holding tight to his mom, and he was crying and just visibly afraid, did not want to come near me, did not want to do anything. They continue kind of this walk down the open bay to kind of where we are, which had to have him pass other children having treatment done and lots of happening in the clinic. And I remember getting him back to the chair and thinking, oh my gosh, how am I going to do this? And so I started out kind of talking with him and his mom just a little bit. And that's where I got a little bit more information from his mom, that unfortunately he'd been to see a previous dentist about 5 years ago. And in an effort to complete some of the treatment that he needed, they strapped him down and kind of continued to work through despite his cries for help, his pain. His mom expressed how nervous he was to be here because of that experience, that trauma that he had suffered. And so I took that into account, and I kind of rolled over to him in my chair, and I just asked him his name. And he was crying so hard he could barely even tell me. And generally, when the kids are crying like that, I kind of sit there and I talk a little bit softer and just kind of make them have to calm down just a little bit to try and hear me or to try and talk. And so I started sharing my name with him, telling him what we were going to do, trying to kind of ease him into what it was that we were going to be working with. We had decided to use Nitrous. One of my colleagues, when he had the exam, recommended that, which is a great adjunct we use along with all of our behavior management techniques because it allows the child to feel a little bit more comfortable. It's air that they breathe in through a nose piece, and it basically just allows them to relax a little bit more with the treatment. They're fully awake. They can talk with us, we talk to them. Some of the kids fall asleep when we're using it just because they are kind of that relaxed at that point, but they're still fully conscious and kind of with us the entire appointment. So I sat him back in the chair finally, and we started talking to him about what the nitrous was. We showed him the nose, we let him touch it. We slowly started to lay the chair back, kind of explaining exactly what we were doing. Wanted to lay him back like he was in bed, that way he could be comfortable. And then we kind of showed him the nitrous nose and we put it on. And a lot of times I like to explain the nitrous nose as kind of, you know, the astronaut nose that's going on. You know, the child's lying down, they've got this on, and it gets to kind of be, you know, I'm going into space kind of feeling. They feel a little bit out of it once the nitrous takes effect. Unfortunately, at this point, despite letting us do these two things, he was still incredibly shaken, incredibly afraid. And so we kind of coax him like I do with all my kids, and I'm telling him, you know, big deep breaths in through your nose, out through your mouth, you know, kind of trying to get him to calm down a little bit to see if he can get some of the effect of the nitrous. And unfortunately, he was really unable to kind of calm himself down, to console himself. And so we kept the nitrous on, but I kind of knew at that point with Veronica, you know, it was going to be a lot about our behavior management with this patient because the nitrous wasn't going to be able to have its full effect because he was crying and he was so afraid. He had several areas, unfortunately, that needed, you know, some attention, especially his upper and lower left side. He had some areas where he had some previous crowns or caps that were on the teeth that had come off, and he needed some attention on those teeth. But I think that was the point where I kind of looked at his mom and I looked at him and I thought, you know, we've got to do something here that makes him have a good experience. And so I talked with his mom about some smaller fillings that he needed done on his upper right side. And I let his mom know, you know, really this appointment, there's no active infection, there's nothing, you know, incredibly serious happening. It's more about his experience today, his ability to trust us and ability to kind of calm himself down for future work. So I talked to her and she agreed that we should do these two on the upper right. They were smaller, a little bit easier to get numb, and I think would have overall given him a better experience. So we laid him down and we started talking about what we were going to do. Always one of the hit or miss points with kids is when you have to get them numb to kind of get the procedure done. And so Anytime I kind of lay the kid back and get them numb, I always kind of take either my mirror or my finger and I start kind of shaking their cheek, a little bit of a distraction. And Veronica, who was absolutely amazing, she's such a calm assistant, so great in these situations, started rubbing the side of his arm to kind of get him to calm down as another distraction technique. And we were able to get him numb. We were able to talk him through the appointment. And as we were doing it, we kind of kept, reassuring him that we weren't going to hurt him and that, if he needed us to raise his hand, that we would stop, that we would talk to him about it. And so he let us finish everything. Tried to get him to breathe some oxygen at the end. That's what we do once we finish a nitrous procedure. They breathe oxygen for about 5 minutes and then they're able to kind of walk out with their parents at the end. But kind of sat him up while he was breathing the oxygen and again just started talking to him, kind of trying to learn more about him, just to kind of reassure him again that we were here to make him feel better and to help him, and that we didn't want him to be afraid, to be scared of us. And he started to kind of slowly calm down just a little bit. I think mostly because he knew it was over and he was going to get to leave, not necessarily because I had done the most amazing job, but it was nice to see that he had calmed down just a little bit. And so we talked to his mom about kind of where to go from here. We recommended to still use the nitrous just because he was more afraid. And we talked to her about what those next visits would entail, that we would kind of separate him into a separate room. That way he could have kind of some private attention, that there wouldn't be the sounds or other kids around or anything like that. It'd be a little bit calmer. And that we would start to work on some of these teeth that needed a little bit more attention. And that these visits could get a little bit longer, they could be a little bit tougher for him, but that we think based on kind of the progress that we tried to make today, it would be better. So a couple months later, Luis came back for a second appointment. And I'd be lying to you if I said I wasn't nervous myself. And I remember prepping, I had an assistant named Melissa that day. I remember prepping her kind of how the last visit had gone, what some of the things we could do to kind of help him relax even more. And this time Luis walked back with Melissa and his mom and his sister, and there was not a tear in his eye. He was smiling, he was happy, and I would have thought you had brought me a completely different kid. He came into the chair, he sat down all by himself, he talked with me, and we laid him back and were able to get one of the more kind of complicated procedures that he was going to need done with the filling. It's a little bit harder of an injection for the kids to have to get numb in those areas. And the entire time he breathed in through his nose, out through his mouth, he let the nitrous work, and we had probably one of the most successful visits that I've had in a very long time. And it was just beautiful to see that by allowing ourselves the ability to take the time when a child might be afraid, to not just give up on the appointment, to not give up on them, to think, oh, they just have to be sedated, they have to go somewhere else, we have to do something different. But just taking the time to talk with them and reassure them, keep the continuity of care, the same provider. You can see the growth that these kids have. And now I've seen Luis many more times since then. I get a smile, I get a hug, and it's just wonderful to see kind of the change that we can do here at the clinic. It's why it's so special.